There are many contributing factors that have impacted the health of the community throughout the years. Socioeconomic factors such as education, income, wealth, occupational status, even residential neighborhoods are all important factors to consider when looking at health outcomes, and were assessed in this process. Those who experience low socioeconomic status, we know that they're more likely to suffer from disease, experience loss of functioning, to be cognitively and physically impaired, and experience higher mortality rates. Currently, the poverty rate in Jackson County is at 19%, which is higher than the state average of 15.4%. Jackson County's median income is also less than the state's median income, and the largest group of individuals being impacted by poverty are among women and children, both in Jackson County and the state of Oregon. But also in Jackson County, women earn less than their male counterparts when it comes to income. And we have more women between the ages of 25 and 34 years of age who are living in poverty in Jackson County, and 25% of the children in Jackson County live in poverty. We also know that having a higher education overall leads to improved health, and this is concerning for the county because there is low graduation rate. Currently, the graduation rate is 75%, which is below the Healthy People 2020 goal, which is to have a graduation rate of 87%. What is even more alarming concerning graduation rates is the disparity among the Latino youth. Currently, the Latino youth have a graduation rate of 64%, which again is lower than the county average. Health outcomes and behaviors is still a concern in the county. Looking at tobacco use, tobacco has some of the greatest health consequences. The use of tobacco increases the risk of coronary heart disease, stroke, and the development of wrist cancer or lung cancer. Smoking tobacco also increases the chance of mortality from chronic obstructive pulmonary disease and lung cancer. And Jackson County has made great improvements to reduce the use of adult tobacco use and youth, but to this day, Jackson County has a higher rate of adults that smoke cigarettes regularly, which is at 20%, and this is higher than the state average of 19%. And despite the decrease in percentage of pregnant women smoking during pregnancy also in the county, Jackson County still has a higher smoking rate of women who are smoking during pregnancy. So currently 14% of pregnant women in Jackson County smoke cigarettes during pregnancy, compared to 11% for the state and 9% nationally. While behaviors such as tobacco use and health outcomes like teen pregnancy, they've all decreased over the years, what is alarming is that the rate of sexually transmitted infections is continuing to trend upward and has set records for the number of cases of sexually transmitted infections in Jackson County. Now, because of this trend, it is one of the most alarming health outcomes for the county. Currently, sexually transmitted infections in the United States and Jackson County, as I mentioned, have reached all-time highs in 2016. Looking at 2016 data, we found out that chlamydia has increased by almost 9%, so 8% here, 84% for gonorrhea, and early syphilis cases, it has increased by 38%. And chlamydia and gonorrhea are the most common and most reported communicable diseases in the United States, and Jackson County does not differ. Sexually transmitted infections can lead to and do lead to further health complications. It is transmitted to the fetus during pregnancy and at birth, causing morbidity and mortality to the fetus and infant, and it does facilitate the transmission of HIV infection. Populations at risk that was demonstrated out of the assessment is that men and men who have sex with men are at greater risk for contracting and transmitting sexually transmitted infections. In 2016, men and men who have sex with men represented 75% of the syphilis cases and 52% of the cases of gonorrhea. Traditionally, there have been more female cases of gonorrhea, but for the first time in 2016, males carried this burden. Majority of the chlamydia cases still remain predominantly females and ranging from the ages of 10 to 29 years of age. And looking at gonorrhea cases, the ages are 20 to 39 years of age, so younger people are getting chlamydia and gonorrhea. Male syphilis cases tend to be older, but again, female cases tend to be younger. Really, if you're looking at the graph, you can see that age 20 to 29 are more females getting syphilis, and this is concerned when you're looking at that reproductive age and then being women transmitting infectious diseases to their fetus. Behaviors that were discovered through the assessment were, the risk factors for contracting and spreading sexually transmitted infections are unprotected vaginal, anal, and oral sex, the number of sexual partners, men who have sex with men, illicit drug use, the utilization of hookup apps. It was also identified that the lack of funding to public health and public health agencies for sexually transmitted infection clinics, staffing and lack of funding and adoption of comprehensive sexual health education that is medically accurate are all contributing to the increase of sexually transmitted infections.